Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan. Let's look at today's top medical news. Study finds that the probiotic LGG reduces the risk of necrotizing enterocolitis in preterm infants. In a recent study published in the European Journal of Clinical Nutrition, a group of researchers assessed the strain-specific effects of LGG in preterm infants through a systematic review and meta-analysis of randomized control trials and non-randomized control trials. Probiotics, which are live microorganisms offering health benefits, have been shown to reduce the risk of NEC, which is a serious intestinal condition in preterm infants at stage 2 or even higher, as well as lower the rates of all-cause mortality, late onset sepsis and time to reach full feeds among preterm infants with very low birth weight. However, challenges remain in determining the optimal strain, duration, dosage and safety of probiotic use.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Study finds that tellurium contamination in foods may elevate the risk of high blood pressure. The likelihood of developing high blood pressure increases with higher levels of tellurium, a contaminant transferred from mining and manufacturing activities to foods. A recent study published in the journal Environmental International has stated improved monitoring of tellurium levels in specific foods could help decrease blood pressure in the general population. The study was led by Nagoya University in Japan. According to Takumi Kagawa, one of the researchers involved in the study, the findings are significant as they indicate that tellurium exposure may contribute to elevated blood pressure, a significant public health concern. In Japan, cereals and legumes such as rice and natto, fermented soya beans, are popular dietary staples. These foods are rich in essential nutrients including high quality carbohydrates, vitamins and minerals which are beneficial for health. AI bowel cancer test determines need for chemotherapy in patients, study relates. A study published in the Journal of Clinical Oncology reveals that a new artificial intelligence test can assess the risk of bowel cancer recurrence and potentially help patients avoid chemotherapy. Led by researchers at the University of Leeds, the test uses an AI algorithm to accurately evaluate the presence of CD3 immune cells in early stage bowel cancer tumors. Bowel cancer, also known as colorectal cancer, affects the large bowel including the colon and the rectum and was diagnosed in 1.9 million cases globally in 2020. In the study, the CD3 score test reliably showed which stage 2 cancers were most likely to recur within 5 years of surgery, and this could be used by clinicians to decide which patients may need further treatment such as chemotherapy. Current methods for deciding which patients with early stage bowel cancer need chemotherapy and which do not are unreliable. Many people receive chemotherapy when they don't need it, and unfortunately some of the people who are not offered chemotherapy go on to experience cancer recurrence. Study finds a connection between cardiovascular risk factors and migraine. Having high blood pressure, specifically high diastolic blood pressure, was linked to a slightly higher odds of ever having migraine in female participants, according to a new study published in the journal Neurology, which is the medical journal of the American Academy of Neurology. Diastolic pressure is when the heart is resting between the beats. However, the study did not find an increased risk between other cardiovascular risk factors and migraine. Previous research shows that migraine is linked to a higher risk of cardiovascular events such as stroke, heart disease and heart attack, but less is known about how risk factors for cardiovascular events relate to having migraine. This study looked at well-known risk factors such as cardiovascular disease such as diabetes, smoking, obesity and high cholesterol, and found an increased odds of having migraine only in female participants with higher diastolic blood pressure. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.